Well, living in Arizona, we certainly get more than our fair share of sun. So we need to be really diligent about protecting our skin. Doctors Onyemaechi Okolo-Taku and Sam Sun are here this morning from Ironwood Cancer and Research Centers to arm us with knowledge about protecting our skin and what could happen if we don't. Thank you both for being here. This is such a timely topic.
Thank you for having us.
Year-round, it's timely. Let's talk about protection and prevention. Why is that so important, and what are the best ways to do that?
Of course. So prevention, as in all things health-related, is far important, more superior to chasing after something once it's already too late. And the same is true when we talk about skin cancers. You know, a lot of the skin cancers that we see happen because of damage that happened decades before. So it's important to wear sunscreen, use barrier clothing, and make sure that you are keeping up with your dermatologist and having annual skin checks, especially here in Arizona.
Yeah, and it's important too because, like you said, some of the damage has occurred decades ago, so get those checks done. All right, let's talk about the different types of sunscreen. You go down the aisle at any pharmacy or grocery store, there are so many to choose from. What are the main differences?
So yes, it can definitely be overwhelming trying to decide what type of sunscreen to use. The most important thing is that you'll want a broad spectrum sunscreen. We get sun damage from UVA and UVB rays. So a broad spectrum covers both of those. There are two main categories. We have mineral and chemical, okay? Mineral can be thought of as more of a physical barrier, okay? It doesn't blend so well into the skin. You can get a white cast from it, but it's better for sensitive skin, and it's also better for younger children. So I recommend mineral-based sunscreens for those populations. For people who want to wear sunscreen more daily, you know, people who just want that daily protection, women who want to wear it under their makeup, you know, chemical sunscreens are better. They blend easier, they're a little bit lighter weight, and so for those categories, those are better.
Okay, but they're both effective, both safe to use. It's just really a preference. Typically. All right. Dr. Sun, let's talk about the three most common types of skin cancers because we do see a lot of those cases, obviously, here in Arizona. What are the most common ones?
So the most common skin cancers are basal cell and squamous cell cancers. They tend to be diagnosed early at stage 1, and it's less common that they spread anywhere else in the body.
Oh, that's good.
A less common cancer, but it still occurs quite a bit, and we see it quite a bit, is melanoma. And melanoma is thought to be a more aggressive type of cancer. It can spread to the regional nodes as well as to other sites in the body, such as the bone or the brain. But now we have a lot more effective therapies for melanoma, so it's not quite as scary as it was in the past.
Okay, let's talk about those therapies because if people are getting those regular checks, they go to their dermatologist and they get some unfortunate news. What are the options that they have?
So the primary treatment for all three common skin cancers is surgery, a particular type of surgery called Mohs surgery that's performed by a trained dermatologist. And after that, it's really important to still see an oncologist specializing in skin cancer. A radiation oncologist, for example, can treat skin cancers that are removed and close to the eyes, the nose, or the lips, because if it comes back in those locations, it's more difficult to do surgery a second time. So radiation plays a crucial role for those patients and in patients that for whatever reason don't want to have surgery. And a medical oncologist specializing in skin cancer can give immunotherapy for melanoma that's stage 2 to 4. Stage 4 is obviously the most advanced, but even stage 2 melanoma where the depth of invasion is just a little bit greater than normal, those patients benefit from immunotherapy as well.
So there's a lot of options. The important message here, do what you can to prevent it and get checked. Thank you both so much for that information. Ironwood Cancer and Research Centers has 15 locations throughout the valley. To learn more about Ironwood Cancer and Research Centers, visit their website, ironwoodcrc.com, or call the number on your screen.